my name is Sophie. I'm here with Batch. We're a 360-degree customer engagement platform. I'm with Anja, one of our clients on the German markets, Kaia Health. I'm also accompanied by my colleague Anja RANNEBERG, AMC, and our colleague Claudia, who's meeting with our clients today as well. We're going to talk about how Kaia Health use Batch to really work on their customer engagement in their go-to-market strategy in the German market, because it's quite specific. We will talk about three parts. We'll first quickly introduce Batch and Kaia Health. We'll talk about the market constraints and opportunities for digital therapeutics companies in Germany, which is quite specific, and then a few journeys that Kaia Health has put in place to engage their users on their app. What is Batch? Batch is a omnichannel customer engagement platform for modern CRM teams. We're a 100% European company with about 100 people across Europe with headquarters in Paris. We are about 8 years old. We have raised in 2021 funds to develop the product further and also develop internationally. A few key facts and figures to give you on the way, to give you an idea. We work on app push messages, in-app messages, web push messages, and email. And all over these channels, we send 650 billion messages per year, and we receive more than 35 million data points from our clients every day. These data points are stored, they're unlimited for the clients that send them to us, and they're stored on our physical servers, bare metal servers that are in France. Thus, your client data never leaves the European Union. Important fact for lots of clients, especially in especially for the data and the health aspects in Germany. We work with a lot of industries across the board, lots of e-commerce. I guess that will be the focus here in the room today. You know some of the logos on RANNEBERG, Decathlon, DM, or the ones that are based in Berlin, BVB, Yelby, Tagesspiegel, Welt. Again, more than 350 clients across Europe and 23 countries over the world. That is about Batch, and I think Anja will take it to tell us a bit more about Kaia Health.
Next, okay. Thank you for having me. I'm excited that you asked me if I wanted to participate. I'm happy to talk about what we're doing with Batch. But yeah, Kaia, for those who don't know, which is probably most of you, we are a maker of digital therapeutics. We create apps that help people with typically chronic health conditions. Our two main products are for back pain as well as COPD. Two quite different diseases, but treatable with a multimodal approach that we look at multiple things. Physical therapy or lung exercises, and then education as well as relaxation techniques, which is super important. Our mission is to make effective therapy accessible to patients anywhere and anytime. Usually you have to go to a doctor's appointment or have to go to your physical therapist in person. For a lot of people, that's a big barrier. And so with our apps, people can do it from home. We're also, I think, numbers-wise, if we go to the next slide, we're in a very similar spot as Batch, coincidentally. We're also about 100 employees. We have two offices, one in Munich and one in New York City. I personally work from Berlin, so I'm not in Munich, but similar sizes. We have about 60 million lives covered, and when we say covered, it means how many people have access to our apps. We have a big market in the US of people having access through their health plans or through their employers. On the German side, we have a B2C solution where we go to market with what's called a DIGA. Some may have heard that concept before. It's an app that's prescribable by a doctor and it's covered by health insurance, very unique to the German market. Hopefully it'll inspire other countries to come to follow with the same process. I think that's good for this.
For that part. When we started working together, it was quite specific. I already mentioned data privacy being a big, important aspect for you, especially with health data, patient data you use on the app. But maybe you can tell us a bit more about the market and why you work with a different CRM provider in the US, and then when you started entering the German market, you had to choose a different provider, and maybe tell us more about the market constraints and what you had, what the opportunities were, and what your strategy was when entering the German market specifically.
Yeah, and I know we were just talking about it before this talk. We started out in Germany, expanded into the US, and then kind of came back to Germany. We We have a CRM tool on the US market, but unfortunately we can't use it. We need to not only be GDPR compliant, but there's another extra law for these types of healthcare apps, digital apps that treat diseases. Because we have patient data, we need to be even at another level of privacy. And so our data is not allowed to be with the EU, and that's one thing that you guys provided, so that was super important to us, because we're dealing with patient data. We have two sets of regulations that we need to follow. Here's a slide that talks about the healthcare market. It's definitely a growing market, even if in an economic downturn maybe that we're seeing right now. We see that healthcare continues to grow, which is a great place to be. The US market is huge, much larger than the German one, but we're also very excited about the opportunities of being and being able to be available to patients free of charge and by insurance. And here's a quote from one of our founders. I think, I'm not going to read the whole thing, but like being available to patients with chronic conditions is super important to help them along the way. And it's also a large market, because I think 75% of Germans have one back pain episode every year. So we can help them, and then COPD is like 10% or so of the population. Numbers vary depending on what study you look at. Next one. I already mentioned this, we're reimbursable by insurance. The law came in place in 2019. The first EDUS came out in October 2020, so we're like almost 2.5 years into this new era on the German healthcare market. Right now there's about, I think I looked yesterday, it was 46 different apps that are in place for everything from depression, anxiety, smoking cessation, obesity, what else is there? A whole bunch of them. I can't name them all right now. But if you look on the BfArM page, which is the federal agency that controls DDAs, you can find them all. And we have 2 of them, which is really great. And so in 2023, or actually at the very end of 2022 and then early 2023, we got approval for 2 DDAs by that German agency. So that was great news for us, but also we had really ambitious goals because it took us quite some time to get that approval from the federal agency. Next, right, and so I think it started, as you said, about a year ago. I think we first started talking because we knew that we needed an especially compliant tool that we could work with. Here's some quotes from the laws that apply to us, but we needed to find a vendor that was able to keep all the data in the EU, and that was quite difficult. She unfortunately no longer works for me, but I had a colleague on my team who spent, I'm going to guess, 4 months researching all the different solutions. And it's not like you can't just go to someone's website and look it up. Are you compliant for DGAS? Because no one knows. And so she had to email and call and provide spreadsheets, and you had to fill them out, she had to fill them out. It took us 4 months to end up at a place where we thought, okay, we may have found a vendor. So yeah, it was quite the process. But I'm thinking with all of you here today, if it works for digital health in Germany, that's probably going to work for everyone, because our standards of privacy are just super high. Next one.
Yeah, we mentioned data privacy earlier, and I think it's a big aspect for a lot of companies in Germany. We have clients like Kaia Health, where GDPR is one thing, but it needs to really go beyond that level. And we have the infrastructure choice that we did years ago, is that all our data is on servers in Europe, and that means it never leaves the European Union, and there's no American instance anywhere. And that means your client data, wherever you want to have, whatever data you have, is safe, and there's no feds that can spy on your client data anytime soon. So that's one aspect that we have a lot of companies quite specific requests that we fulfill those. In terms of omnichannel experiences, you have, as you said, quite a lot of goals and requirements that you want to have or achieve in 2023. And our aim is to go through a few of those that you've put in place and that you're working on, but maybe more about the CRM challenges that you're focusing on.
Yeah. I mean, like I said, we have ambitious goals for this year. We need to grow super fast. We're trying to work kind of a two-pronged approach. We talk to patients because we need to educate the patient audience about what we do, as well as the doctors. With BASH, we focus on the patient side. But yeah, we want to constantly grow our user base and get people interested. we're driving a whole bunch of traffic to our website from different types of campaigns. We do PR, we run Facebook campaigns, et cetera, so we get an influx of users every day, and we want to make sure that we can continue to talk to them using CRM. And it's a combination of, as you said before, in-out notifications, push messages, emailing, et cetera, to make sure that they know about us, that they come back when they need us, and that they continue to be engaged. I'm just going to look at the second one. We do have a data-centric approach. It's super important to us that we have all the data in one place. I think that was a big selling point for us, that we not only had mobile notifications in the system, but also email. And what's important to us from a user perspective is not be annoying and be relevant when it counts, and also not mess up people's trust. Especially in healthcare, you can't mess up, you can't make mistakes, unfortunately. We don't want any data leaks, we don't want anything like that, so it's very important that we do it right, and that we can trigger messages at the right time and not, send 11 emails and 5 push notifications in 10 minutes and people just want to unsubscribe. And then lastly, maybe as we're launching, less important, but it will come up in a couple months, is the recurrence. People, if they have back pain, hopefully we can heal them and they feel better after and don't need us anymore. With COPD, unfortunately, that's not a disease that you can heal. So we want to make sure that people stay engaged and come back at the end of their prescription, which is usually 12 weeks. So we have a 3-month cycle where we want to keep people engaged in using the app, because we know as people create habits by using the app, they will get healthier or stabilize in the case of COPD and not get worse. Next one. This is a nice summary of why we chose Batch. I think I already mentioned a few things that we liked about Batch, but it's the omnichannel capacity, that we have everything in one place, that we can be holistic, that people get relevant information when they need it, that it was data compliant, EU centered data, and we could maintain the privacy that the legislators are asking of us. And then lastly, definitely a very happy customer. One thing that definitely made a difference for us is the level of attention that we're getting from Batch, and the expertise that they're helping us with. We have a very small team, very small, if you want to talk about it. And so I take any support that I can get right now. To build out our life cycles and make sure that we get in a good place where we can grow our users and generate all the revenue that we can get.
And I think what we want to look at is a few of those omnichannel scenarios, because you have 3 focus points that are more on activation, engagement, and then retention of the users, which is similar to what you're also working on in e-commerce, is you want to activate them on the app or on your website to make sure that they're engaged with your brand, with your product, with your website, with your app, depending on the channel that you have. And of course, keep them there, retain them. And I think the journeys that you've put in place, there's a few of them. We'll go into more detail in the next slide, in 3 of them, but I think maybe you're going to talk more about the different scenarios that you put in place.
So we're not retail, right? It's a little bit different in healthcare. The prescription process is quite different from dropping something in the shopping cart and checking out. So we need to make people become aware of Kaia, and that's a solution for them in helping them with COPD or with back pain. Hopefully they'll come to the website, check out all the blog posts that we have and articles, subscribe to a newsletter, something like that. But then it's really important for us that they sign up for the product. So it's kind of a lead capture that we have online, and then we need to get them to use the app. In the meantime, though, while this is happening, they also need to go to a doctor and get a prescription, which oftentimes happens offline. You go in person with your feet and not your phone. Get your prescription, you send your prescription to your health insurance, and then they send you a code, and you type that code into the app, and it activates it. So it's a pretty involved process, and quite tricky for us to track, because a lot of stuff happens offline. But then once we have them, hopefully, we need to welcome them into the app and tell them how to be engaged and how to create new habits. Do their first exercises and keep going. And then once they're customers, obviously we want to keep them engaged, make sure that they do their exercises. I was just saying earlier, we try to get people to do at least 8 days of exercises, because that is how we've tracked, they create habits and keep going. Once they have 8, they usually keep going after. And then if people want to become inactive, we also want to talk to them about that and, make sure you do your, come back today, you haven't done your exercises in 3 days, but we have to be super mindful that it's not creepy. So it's not like, oh, your pain is worse, I'm sorry, here's a link for you. And then at the end of the 12-week cycle, we want to make sure that they either come back when they need it and remember us next time, or if they have COPD, they should just keep going because they need to maintain their activity levels. It's really important to not get worse when you have COPD. Okay. This is very detailed, and I don't want to get into all the details, but we've tried to map out what the different scenarios look like. The first one is activation, so getting new members in the door and making sure they know what they need to do to get a prescription because it's quite complicated. We have so many materials explaining what the steps are to go to the doctor and what to ask for and what the prescription ID number is. They should tell their doctor, and we're doing this in parallel also when we're talking to doctors, which is usually in person. So get the app, get the prescription, get your code from insurance, etc., to make sure we get people to become active users and redeem their reimbursement code that they get from insurance. This is the first one. You can go to the next one. This is engagement. So they're in the app now. Maybe they've opened it the first time, like, oh my god, this is physical exercise. What do they want from me now? But we try to get people to use the app on a regular basis. You can create a schedule and say, I will be reminded, every day or every other day. You can take breaks too, it's okay. 3 types of things you can do in the app. It's either physical exercise, relaxation, or education you can do. So knowledge assessments just to see where you are and what you should know about back pain or COPD, and it really helps people manage their symptoms better. And so, yeah, we'll keep reminding people to do their exercises and come back on a regular basis and not become inactive, basically. Next. And then retention, this is what I was already talking about. So at the end of their life cycle, we want to make sure that they either stay on or remember us for next time. That's
But in your case, you have the possibility that they actually exit the customer journey or
They
the
might,
user journey in that
yeah,
sense, which
and
is
we might be happy for them because they've mastered their back pain and they're doing better now, which is great. But revenue is also great.
And I think what's key in that part is that you're really engaging the users or the patients in this case on the different channels. You started with email, you might capture them on the website, get them through email, make sure that they're there, use the app, and then actually start with app push messages, in-app messages to make sure that they're engaged. And that's what we're really trying to get our clients, our batch clients to do, is work on 360-degree omnichannel customer engagement to make sure that your users, customers, or patients are there and that you communicate and get your right and relevant message across at the right time on the right device and on the right channel.